a continuous effort must be made in order to ensure proper transportation of clinical specimens. Full cooperation of nursing staff and others concerned with specimen collection and transportation is required and can be achieved once they are made aware of the principles involved and the significance of what they are being asked to do. Despite increased point-of-care testing in many areas of laboratory medicine, the vast majority of specimens are collected in one place and transported to another for analysis. The proper timing and procedure of transporting a sample ensure that sample remains uncontaminated and yields a correct result that is critical in deciding the treatment plan for the given condition. As a hospital assistant, your role is to assist the nurse or the doctor while the sample is collected and labeled and making sure that the sample is delivered to the lab in the right time. Procedure to transport specimens. The following procedures should be adopted for the transport of all specimens and also all cultures for confirmation. These apply within hospitals and laboratories as well as for specimens sent to the reference laboratory. The primary container should be screwed tight, labeled and placed in an intact plastic bag. A high-risk label should be affixed to the container. Each specimen must be placed in a leak-proof secondary container with sufficient absorbent material to absorb all the contents should leakage occur. The secondary container should be externally disinfected. It is the responsibility of the assistant to ensure the correct designation, packaging, labeling, and documentation of all infectious substances and diagnostic specimens in good condition. The efficient transport and transfer of infectious materials requires good coordination between the nurse, the assistant, and the lab technician, that is the receiving laboratory, to ensure that the material is transported safely and arrives on time. Such coordination depends upon well-established communication and a partner relationship between the three parties. Importance of labeling. Every specimen should be properly labeled. Every specimen container and request form must describe the nature of the specimen and source. Full patient information allows the laboratory staff to identify the source quickly in the event of the specimen and the form becoming separated. All specimens must be placed in a specimen bag with the request form in the separate pocket of the bag. Labeling plays an important role in the transportation of the correct sample to the lab for testing and is a critical step to ensure the timely delivery of the sample. Precautions to be taken while transporting specimens. Specimens, if not handled and transported safely, can pose a risk of infection to all people involved, including healthcare workers, patients, their caretakers, receptionists, and transport personnel. It is important to keep in mind that sample transport and storage conditions, together with the time interval between collection and testing, can have an important effect on the quality of test results. Specimen data forms and other types of information that identify or describe the specimen should be taped to the outside of the container. The package should be certified to this standard and carry appropriate certification numbers on the tertiary packaging along with the following information. Biohazard, danger of infection symbol. Instructions not to open if found. With the above precautions in mind, you must ensure that specimen collected is promptly transported to the lab for testing.